I'd like to welcome also this particular motion and give praise to the regional group for bringing this really important motion before the Dáil today. I'd like to give a special mention to Caution Gowley, who did massive work in the development of this particular motion as well. This is a really strong motion, Minister, and if implemented would make a radical change to hundreds of thousands of lives around the country. I also welcome the fact that the regional group has done good work in trying to get cross-party support for this particular motion. But I would ask that the government would not just give a nod to this bill tonight at the vote, but take the bull by the horns when it comes to this particular motion and implement it. If we were to add up all the words that have been articulated in this Dáil with regards to mental health over the years and think that they will make a difference in people's lives, we would be wrong. The truth of the matter is we need to put actions where goodwill has been articulated in this chamber. I'd like to take the lens back a little bit if I can. The society that we're building throughout Ireland at the moment is having an increasing negative impact on mental health. If you look at the pressures that exist on families with regards work, with regards commuting, with regards even children dealing with social media, with bullying, with alcoholism, with drug addiction, etc. And then we add to that the pressures that are now coming from this COVID restrictions. There is an economic wasteland being developed amongst many sectors of society that itself will have an enormous impact on people's lives. And the debts that's been accrued to this society, knowing the government's track record, will likely lead to austerity over the next number of years, which in itself will have a shocking negative aspect on people's lives. Human interaction, relationships are some of the best ways to deal with mental health issues, and that has been taken away from many people in our society as well. Another aspect of all of this is the fact that the government is no longer measuring the key indicators in this area. I've asked a number of key questions of the Minister for Health around suicide rates, etc. And the Minister for Health hasn't been able to answer those questions. And if you can't measure, you can't manage. I've spoken to NGOs. They have told me that there is increasing pressure on mental health on families around the country. I put in a parliamentary question to the Minister. The Minister himself has admitted to me that he has received letters from NGOs which show an increase of mental health pressures and of suicide rates during the pandemic. His response indicates that he's been contacted and that there is concerns about the increased suicide that has been expressed, but the Minister hasn't elaborated on that, unfortunately. And I'd like, Minister, if you would look into that yourself as well. These increased restrictions have had an enormous effect on community-based mental health services, and they've had to radically change the way that they operate through remote consultations, telephone calls, etc. You know, drug addiction, alcohol addiction, all of these therapies have Many of these therapies have become one step removed from human interactions, and that has significantly reduced their impact as well. In the short time that I've left, I do want to talk about one really important element. Consultants have spoken to me in depth, Minister, around the fact that there's a shortage of psychiatric beds in Ireland at the moment, and that this is actually getting worse. It's getting worse because the government policy has been to reduce the number of psychiatric beds that have been in Ireland, despite the fact that we already have one of the lowest proportions of beds per capita in the developed world. And Meath, my own county, is a microcosm of this. You know, 4 or 5 years ago, we had a 24-hour mental health unit in our local hospital. That was closed down by the Fine Gael government, and people in Meath now, the 200,000 people living in the county, have to leave the county to go to County Louth to access services currently. We were told that we would be left with a day hospital for mental health services in County Meath, but in exactly the same way, the trend has continued, and that day hospital has been closed in recent times. So, you know, people from right across the county have to exit the county to get to mental health services now in a county that has probably the 5th highest population in the country. So in real terms, by closing beds, what we're doing is we're sending people into either homelessness or prison. We're sending people into really difficult situations. I want to just make, if I can, in the seconds I've left, a special attention to older people in our society. Older people who have been the most exposed by the government during this pandemic. We have lost an enormous number of older people just in the last year. Well over 1,000 older people have died in nursing homes because of this pandemic. They are under increasing stresses and strains. They now have to deal with isolation, lack of human interaction from their families because they don't get the level of visits that they would normally get. And now they have the question of the vaccine coming in front of them. And I would ask that the Minister here would do the best that he and she can to make sure that we actually get the supports to older people so that they can deal with the stresses, the strains and the threats that they're experiencing within the nursing home situation.